Time for Health Watch, and doctors are now using an old medication in a new way to help prevent sexually transmitted infections. On average, Shreveport has 1,758 cases of sexually transmitted infections per 100,000 people, which is pretty common. And the most common STIs in Shreveport include chlamydia, gonorrhea, trichomonas, HIV, and syphilis. Back in June of this year, the CDC released recommendations for starting patients on what's called DoxyPEP. It stands for doxycycline post-exposure prophylaxis. And Dr. Paulette Pinargote is an infectious disease specialist with Oxygen LSU Health, and she says DoxyPEP is intended for someone who has already had a sexual encounter, and if they are concerned they may have acquired syphilis, gonorrhea, or chlamydia.
They can take doxycycline, 200 milligrams, just one single dose. That should be taken within 72 hours of the sexual encounter. However, even if patients do get infected with syphilis, chlamydia, or gonorrhea, we have treatment, of course, for that. But obviously, if we can prevent that from happening, that would be great.
And doxycycline is a widely used antibiotic for various infections, and while nausea and vomiting are common side effects, they're pretty rare with a single use. And there's concern about antibiotic resistance with long-term use of doxycycline, but currently Pinargote mentions there isn't enough data to confirm this. It's important to get regular screenings from your primary care doctor and your partner. So for instance, if your partner tests positive for syphilis, you should also get screened and possibly treated. Using condoms properly can also help prevent the spread of STIs. For more information, it's recommended to consult your primary care provider or request a referral to an infectious disease specialist.